Well, thank you. I'd like to welcome you officially to the start of the UCLA Center for Occupational and Environmental Health's Spring Symposium, Toxics in Everyday Life. And my name is Christina Batteate. I'm the outreach coordinator for the center. And as such, it is my distinct pleasure to welcome you to this day. I'm really excited about the speakers that we have, and I'd like to welcome anybody who is participating via live stream. As well, we have opportunities for you to join in on the discussion. We also got support from a couple other folks here at UCLA, the Institute for Society and Genetics, and the Emmett Institute on Climate Change and the Environment in the UCLA School of Law, and also the Burroughs Wellcome Fund. So thank you to all of our supporters. And I'd like, in the spirit of learning today, whether you're here in the room or participating online, if you decide to post something that you've learned, a fun fact, go ahead and tag Toxics in Everyday Life. And you can always visit us on social media or at us. And specifically for people who are participating online, we have a place for you to log questions, and we'll pass those on to the speaker for you. So you'll go to Slido, www.slido.com, and enter the code TALKS, and then you can just log your questions, and we'll pass them on. So food is outside if you haven't grabbed any already. We'll have lunch, etc. Bathrooms are just down the corridor. Go out the door to the left. And we will have a reception to follow. It begins at 4:30 p.m. There'll also be hors d'oeuvres and adult beverages. So with that, my introduction, I would like to welcome the director of our center, Michael Jerrett. Dr. Jerrett is an internationally recognized expert in geographic information science for exposure assessment and spatial epidemiology. He's professor and chair in the Environmental Health Sciences Department, and as I mentioned, he's the director of COEH. So thank you.
Thank you very much, Christina, for that kind introduction. And thank you to Christina and Professors Tim Malloy and Patrick Allaire for just a tremendous amount of work to bring this together. And we're expecting throughout the day some 170 people have signed up. So we'll in typical university fashion, have people coming in and out as the talks that interest them. But we have a tremendous group of speakers and panelists today. I'm really looking forward to the day and sharing our thoughts about toxics in everyday life. I think it's particularly germane that we're having this symposium at COEH because the Center for Occupational and Environmental Health was born out of the poisoning of workers at a pesticide plant that left many of the male workers sterilized for life. So in 1978, there was state legislation established to form two major occupational health centers, one in Northern California that's led by John Bombs, and then we've had a split in Southern California because it's such a large place, so we have one at Irvine led by Dean Baker, and then the one at UCLA by myself. I think it's also a very germane time to talk about toxics in everyday life because it could never be more important for us to know the toxics we're facing in this time of almost unprecedented regulatory retrenchment and funding cutbacks for environmental health research. And I think that's something that as members of the public begin to tune into what's happening, we'll begin to see that their interest in the toxics they face in everyday life is going to increase because they're not going to be able to trust their governments necessarily to protect their health in the same way they have in the past. I think when we look at the vast array of exposures that we face, the potential for cumulative and synergistic effects that we simply just don't have the scientific understanding of yet is growing. And when Christopher Wilde in 2005 coined the term exposome, meaning the totality of exposures that we face through our entire life, it was really just a concept at that point, something that we could aspire to. But since then, we've seen the evolution of metabolomics, of exposure science methodologies, so that we've learned a tremendous amount about the toxics that we carry with us every day in our lives and how those are increasing through consumer products and other everyday exposures that we face, such as commuting and air pollution, water pollution. So what we know now is that we have a tremendous load of toxics in our systems that they are probably affecting the health of millions of people globally, probably billions, and that they're affecting people that are particularly vulnerable, people like pregnant women, children, people with pre-existing medical conditions, people that are elderly, and they are also affecting healthy people. And we know they're probably shortening lives, and they're certainly leading to many millions of preventable disabilities. So as we go into this day, I think it's great for us to think about the future and how we can begin to reduce toxics in our everyday lives, and how we can educate ourselves to better facilitate action so that regulatory retrenchments and funding cutbacks that are in motion now will not be as severe as they could be. And perhaps in the next few years, we'll see a better understanding of these exposures and what we might do about them, and a more progressive agenda that could be pursued. And certainly here in the state of California, we've been leaders in addressing toxics in everyday life through our Office of Environmental Health Hazards Assessment, Cal EPA, the California Air Resources Board. And we will continue in California to try to lead the globe and the nation to a better resolution of how to deal with these toxics in our everyday lives. So we have a great list of speakers coming up, and I want to turn it over now to Professor Allaire.